Hello and welcome to another edition of Health Solutions with Sean and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Sean Needham, along with my producer, Lindsay, today. And today we have the privilege and honor of having Spike Cohen, Libertarian Vice Presidential Candidate, on our show today. I'm super excited. He's a super busy guy. We've been trying to have him on for the last few months now, and he has been super busy campaigning, as you can only imagine. So, as always, you can watch us on my Facebook Live and the Moses Lake Professional Pharmacy YouTube site. Also, you can catch us on most of the podcast forums, so iTunes, SoundCloud, Google Play, all of those. So go to those forums. You can always listen there. After we stream live, we will have those edited and put up on those forums. And Spike Cohen, welcome to our show.
Thank you, Sean, for having me on. I'm really happy that we were able to make this work. We actually, just to put it in perspective, like you said, on being busy campaigning, I just got back from a 3-week-long bus tour that we did that started in Cincinnati, Ohio, just under a month ago, and hit almost every state between Ohio and Washington, and ended in Olympia 2 days ago. So they're definitely keeping me busy, but this is one of those rare days I get to be at home and doing interviews from the comfort of our guest room. So thanks for having me on.
Yeah, well, welcome back home. So, do you have any idea how many cities and how many days that you traveled to?
On the bus tour?
Yeah, on the bus tour.
Oh, see, I should probably know this. I could count them. I believe 15. So I can do that. Cincinnati, Flint, Highland, Indiana, Des Moines, Iowa, Wichita, Kansas, Lincoln, Nebraska, or actually Lincoln, Nebraska, Wichita, Kansas, Lubbock, Texas, Tempe, Arizona, San Diego, Huntington Beach, Vegas, Salt Lake City, Reno, Oakland, Eugene, Oregon, Portland, Oregon, Olympia, Washington. So what's that, 17?
Wow. Yeah, that'll keep you busy. Wow. Well, good for you. Hopefully you got some sleep.
I did. In between the events, I would sleep on the bus or in the hotel room or on the airplane, and then we would be at the next event. And it was fast-paced, but it was a blast. And, while our opponents are in their bunkers and basements hiding away from the American people who are literally on the streets expressing their outrage at the totally predictable consequences of bad Republican policies, we are out in the streets. Joe Jorgensen and I and the Libertarian Party are out in the streets meeting with everyday Americans, talking with them about the issues they are facing and telling them how our common sense libertarian solutions are the fix to those problems.
So tell us, what is libertarian solutions? What's a libertarian, and what are libertarian principles and solutions?
Absolutely. So libertarianism, in a nutshell, is the belief that, and we could spend the next several years talking about what libertarianism.
I love it. I know. I could too.
But in terms of in a nutshell, libertarianism is the belief that we own ourselves, which means that we own our lives and our bodies. That means that we own our property, which is the product of our bodies, the product of our labor, and that we own these things. They are inherent to us. We can give them away. We can sell them. We can rent them. We can do what we want because they are inherently ours. And that when people take from us, that is an act of aggression, and that aggression is not wrong. Is not just wrong from a moral standpoint, that it's wrong to harm people. It's wrong to take things from them. It's wrong to try to subjugate them and tell them what to do. But it also doesn't work from a utilitarian sense. Sean, if I can take from you and everyone else watching this whenever I see fit, I'm not going to be a good steward of what I have, because I don't need to make good decisions, because I can simply take more from y'all whenever I see fit. And you aren't necessarily going to make the best decisions, because you know that I can come and take it from you whenever I see fit. So you might as well use it while you can. And if we look at every bad policy that is in place, including in healthcare, it is simply a situation in which Republicans and Democrats, in their exclusive control of every lever of power of government for the past 160 years, have set up a system whereby they presume the authority to take from us and aggress upon us anytime they see fit. And what have they done with that? Whenever they've done so, they have used that control to take power and freedom and money from everyday Americans to give to themselves and the well-heeled, politically connected billionaire cronies who have bought and paid for them to be in office. What libertarians propose is to dismantle these oppressive, centrally defined, centrally planned, arbitrarily defined, and crony-friendly policies, and give that power and that freedom and that wealth back to the American people so that they can thrive and prosper in ways that are often not possible to even do right now.
I love it. Boy, I can tell you are so passionate about this subject, and I am so glad that you're out there educating people about it, because every person really, deep down inside, every person as a human, I think we want liberty. We want liberty, and we will strive for that. And the more we have that, I think the happier everybody will be. So a little bit of background of how I met you. So I was running a podcast for Anthony Welty, who's a Libertarian candidate that ran for a Washington State Insurance Commissioner, and had some great libertarian policies, about how fixing healthcare in this state, which, there are a lot of bad policies in this state that takes away people's freedoms. And I was supportive of Anthony because, he really wanted people to have liberty to choose what kind of insurance they could choose, what kind of, what kind of deductible, all that kind of stuff. And I'm really sad that he didn't get get in past the primary, because I would like to see him in there. There's another thing I'll talk about later.
But I want to say, just
Go
in
ahead.
Anthony's defense, he did break the record for a libertarian running in that position in spades. I mean, he got nearly 500,000 votes on a campaign that was largely run by him and a handful of other people that were helping. If you do the vote per dollar spent in campaigning, he did exponentially better than anyone else running. He set a proof of concept for the idea that you can run for what is a relatively obscure office, but bring libertarian solutions to that specific office and draw a lot of attention to it. Also, and this is a bit of a brag on my part, Anthony was actually one of the advanced planners on the bus tour. So I was actually on the bus for 3 weeks with Anthony. So that was really cool.
I saw that. That's great. Yeah, that was good for Anthony. I bet he had Vol. I bet you guys really got along well. So that's awesome.
Absolutely.
Yeah,
he's fantastic. He's incredibly. Yeah, he's a great guy to hang around with, and he's also incredibly adept and incredibly effective at anything he puts his mind to. He did a fantastic job with it, and he's actually we're going to be announcing the dates for the second leg of the tour in about a month, and he'll be on that as well if he can.
Cool. Yeah, right. So just to go back a little bit, when I was on that podcast with Anthony, I was hearing you talk about some free market principles in healthcare, and one of the things you mentioned what caused a lot of the problems with our healthcare system is government intervention. So don't think that government can fix it, because government's the one that screwed it up. And
exactly,
it really hit home with me because I wrote a book about it. The book is called Sickened: How the Government Ruined Healthcare and How to Fix It. And it has a history in there about how this all started out. And you basically could have darn near wrote my book with some of your comments, because you said, and I want your comment, your comment and explanation on this. You said one of the things that caused this problem that we have in healthcare is price and wage freezes back in the 1940s. Can you expand on that?
Yeah, absolutely. And this demonstrates how, obviously the subject we're talking about right now is healthcare, but so often these things bleed into each other. And it's why libertarians tend to look at things in a holistic manner instead of in a similar way. In medicine, it's best to look at the entire body as opposed to just a specific symptom. In the same way, when we're looking at these policies, we often look at how policies that weren't really directly or even indirectly related to healthcare ended up leading to massive problems in another sector, like, for example, healthcare. So in this example, during World War II, the federal government, the U.S. federal government, was basically employing almost everyone in order to pay for the war, in order to do the war effort. And in order to try to keep costs down, FDR, President Roosevelt, proposed wage caps, and he threatened wage caps. He threatened that if businesses didn't stop reducing what they were paying workers, then he would introduce wage caps. And the reason this was happening was because supply and demand. There was great supply, there was great demand for labor, and there wasn't much supply of it because everyone was already doing something else working for the war effort. So employers started trying to poach employees, which, by the way, this demonstrates how when an economy is doing well and there's a, when the best way to see wage increases is to have a very tight job market. And the best way to do that, obviously, is to deregulate the market so that there's more jobs, there's more people working and more jobs available and fewer people to actually fill those spots. But I digress. When that happened, when those wage caps were threatened, employers, in order to be able to keep their wages flat, they found a way around it. The way around it was to start offering non-wage benefits. Those benefits included things like pensions. They included things like childcare. They included anything they could include that wasn't a wage, an actual wage that they pay every week. One of the things they introduced was comprehensive health insurance. Now, up until that point, health insurance was kind of a catastrophic plan thing that you could either get or not get. You'd pay a small nuisance fee every month. And if something catastrophic happened, you were in a terrible accident, or you had cancer or some other chronic health issue or some major health catastrophe, the insurance would pay for whatever medical care you needed. In a similar way to how people will get liability coverage for their car, as opposed to comprehensive car insurance that would cover your gas and your tire pressure checks and all of that stuff. They leave that to you to pay for out of pocket, and instead they just pay if there's any catastrophic things that happen. When comprehensive health insurance got introduced into the market, and keep in mind, again, this was not something the market ever demonstrated that it wanted until it was introduced as a way to get around proposed government regulations. Key point there, because the health insurance is not free market health care. We did not want it. The market did not bear it out. Comprehensive health insurance was introduced because of threatened federal regulations. Okay, so now comprehensive health insurance introduced. What happens? Costs start to go up faster than the general cost of living, which they had not done up until that point. Up until that point, the cost of healthcare went up and down with the general cost of living. Here's what happened. Now, instead of you and me, the patient, going to the doctor and saying, I would like this, I need this to be done, or doc, I'm not feeling too good, and the doctor says, oh, okay, well, you need this, 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 and this is what I charge, and then us deciding whether we want to go with them to get it done or go with one of their competitors and get a second opinion or whatever else. Now it's our insurance companies deciding all of that. And because there is now that separation between the person who is getting the care and the person who is paying for the care, there's now a level of inefficiency there. And there's also all these people whose salaries have to be paid. You've added a level of unnecessary bureaucracy, and all that has to be paid for. That is reflected in the cost of your overall care. So costs start going up faster than the cost of living. This continued to go on for about 20 years or so, until finally the American people started saying, wow, health coverage is starting to get really expensive, and we've got a growing population coming out of the pre-World War II baby boom, a growing population of people who are, because these were the people that were from the World War I baby boom who were now reaching retirement age. And there were people, and they were saying, wait a second, I'm not going to be working anymore. I don't see how I'm going to be able to afford my health care if I don't have a salary. So Congress decided to make it even worse. They introduced Medicare and Medicaid. This was going to give largely subsidized health insurance, 80%, 20%, to people who reached retirement age, which at the time was 65, and it would also give free health care to the poor. The people who were against this said that this would make it even worse, that you are introducing even more regulatory burdens, you're introducing even more bureaucracy, you're introducing even more separations between those who are paying for the care and who are receiving the care, which means you're removing the price equilibrium that is inherent in a free market, and you're going to make costs go out of control. They passed it anyway. That's exactly what's happened. The costs now are going up at an even higher rate than they were before those things were introduced. And so that brings us into the 1980s and 1990s, where they start implementing even more additions to Medicare and Medicaid, expanding Medicaid and Medicare coverage. This is when you go into the early 2000s with Medicare Part D to pay for to pay for pharmaceuticals. The cost of pharmaceuticals going out of control because of patent protections that allow them to sell drugs for thousands or tens of thousands of times as much as they could charge in any other country because of those patent protections, and competitors not being able to also make those same drugs that have been around longer than any of us have been born, like insulin and epinephrine. And because it's the insurers, the insurance companies, and Medicare and Medicaid that are the primary aggregators of demand by paying for those things, they can charge whatever they want because they don't have to have a price equilibrium. You don't have to be able to afford it as long as your insurance can, as long as Medicare and Medicaid can afford it. And of course, they can afford it because they're just take it from your tax dollars and run up debt in your name and make you pay for it for the next 40 years. And then in those situations, if you're one of those unfortunate people who's not covered, you just die because you can't afford it. That brings us to the Obamacare debate. They were going to introduce universal health care, which basically is single payer, like they have in Canada or they have in many other countries. It turned into instead a bit of a fiasco, which is now basically a total hybrid system where the government is controlling every single lever of what things cost. And the idea is, oh, well, we're going to be able to negotiate much better than the average American is because we have a much larger economy of scale. The exact opposite has happened. They have introduced massive increases in bureaucracy. The cost of things have gone through the roof. Their negotiation with the pharmaceutical companies has been charge whatever you want. We'll stick the American taxpayer with the bill. Yep. And it has led to the cost increases. We were told if you want to keep your insurance, you can keep it. We all lost our insurance. We now have to have compliant plans. We were told that costs would go down as much as $1,500 for family. They've gone spiraled out of control. Trump comes in on a promise to repeal it. Instead, he introduces even more regulations that drives up the cost even more. This is a perfect case study. What we have looked at for the last nearly 100 years, Sean, is a perfect case study of what happens when the government takes a market that largely doesn't have any problems. Right. Not that it was perfect, but it largely didn't have any problems, and decides, I'm going to fix this thing that has no problems, and creates massive problems. If your car insurance was the same as your health insurance, where instead of you just getting the stuff you need, buying gas when you need it, buying new tires when you need it, taking care of fixing stuff on your car, dents on your car when you need it, if instead you just had comprehensive care, you would be spending thousands or even tens of thousands of dollars a month, and you would be waiting weeks to get gas and tires and everything else that you need, because there would be a massive and costly bureaucracy that drives up the cost. There was a recent study that said that, and I forget who it was from, that said that 75% of the cost of healthcare is just the red tape compliance costs from Medicare, Medicaid, and government mandated insurance. Now, keep in mind, that is not the cost of providing those services to the people who need them. That is the cost of medical professionals having to demonstrate compliance with the laws and to comply with them. 75%, 3/4 on every dollar that you are spending in healthcare is just the cost of the bureaucracy. And that makes perfect sense. You go to the hospital. What do you see? You see one doctor, you see 2 or 3 nurses, and you see like 15 administrators. It's not because they need that many administrators to run the hospital. It's because they need that many administrators to prove compliance with the laws, including laws that require them to have that many administrators. And this does many things. This makes the cost go up directly because you're having to pay for all those administrators. This makes an increasing number of doctors retire early because they can't afford to do it anymore. This makes an increasing number of large health management companies fire entire wings of medical professionals because they can't afford to keep them on. And it causes, and this is something we won't see for decades, we'll be feeling this for the next several decades, people that would have become doctors who are doing a cost-benefit analysis. They look at what the student loans are going to cost them to become a medical professional. They look at what the cost will be to become one, and they realize there's no way they're going to make any money. So they go and find something else to do instead. That is leading, it is already leading, and will continue to lead to a massive increase in the doctor and medical professional shortage, pharmacists, doctors, nurses, and everything else. That is, and it all started because FDR wanted to keep costs down during the war. And it just shows how government getting involved in something just makes it worse.
Yeah, absolutely. Well, thank you. You just summed up a chapter in my book. Thank you so much. So just to let our viewers know, it was Executive Order 9328 in 1943 under the FDR administration that put in price and wage freezes. And then it was a Social Security amendment in 1965 where Johnson signed in Medicare. And of course, that all piggybacked, or Medicare piggybacked on Social Security from 1935. So Social Security, we got to go back to Social Security to look at how the government really started to ruin healthcare. And then, of course, the Affordable Care Act. Once Social Security, Medicare passed, the Affordable Care Act piggybacked on that in 2010. And you're exactly right. Costs have went up astronomically. You look at my book, utilization of nursing homes went up 700% after Medicare was passed within a few years. Now, that doesn't mean that those people really were going without care before and didn't need to be in nursing homes. It just meant that there was overutilization. People were doing things they didn't have to do anymore. It happens in healthcare all the time. Unnecessary procedures being done because a third party pays the bill. Do you have anything to say about that?
So this is the reality of anything in the market. When you have someone, and keep in mind, a lot of doctors and nurses, I have a lot of friends, and I've spoken with many more who are medical professionals. And in every aspect of what they do, their jobs are made harder, and we didn't need COVID-19 to prove that. With this, what we're seeing is that their jobs are made harder. Every time they submit something, it can take weeks, sometimes even months to get the money back that they've already put out money for the cost of all the goods that they needed, the cost of the equipment they needed, and everything else, the cost of the labor and everything. And now they're waiting to get reimbursed by Medicare, Medicaid, and government mandated insurance. And it's sometimes taking weeks and months. And so the way that you get around that is you have to pad it as much as possible with as many things as possible, because you're waiting to even get the money in the first place. If instead you remove all of that red tape, you remove all of that bureaucracy, and now it's you and your medical professional deciding what you need based on what is necessary, what you can afford, and and what your other options are. Like anything else, I always try to compare, because this is similar to how when the Soviet Union collapsed, there were people saying, how are we going to be able to get food without bread lines? Because they were so conditioned that that's how they needed to get food, was bread lines. The idea that the market would provide food was horrifying to them. What do you mean the market's going to provide food? I need my bread line. This is similar with healthcare. People say, well, but without health insurance, how would we even get healthcare? How could we even afford healthcare? And yet every day they go and they buy food, and they buy water, and they buy the things that they need. Well, imagine if you want a chicken sandwich, you go to a restaurant, you see what the price of the chicken sandwich is, and you say, okay, that sounds good. Or you go, you know what, I'll get a chicken sandwich somewhere else. You need that chicken sandwich. If you do not eat, you will pretty quickly die. But you can still have time to make some choices as to what kind of chicken sandwich you want. Some of us have plenty of time. And so so we make these choices, and we do it based on a cost benefit analysis of how good the sandwich is, if it's worth that cost, or if I can go somewhere else. It's called price equilibrium. If I charged $1,000 for a chicken sandwich, I know that no one would buy it because I can't charge that much. But if there's comprehensive chicken sandwich insurance, and we declare that chicken sandwich is a human right, now I can charge whatever I want. I can also try to get it regulated that only certain people can provide chicken sandwiches. I can demonstrate, because I'm a bigger chicken sandwich supplier, I'm the only one that can afford to deal with the compliance costs of proving that my chicken sandwiches meet the various chicken sandwich insurance and chicken sandwich mandate regulations and red tape. And now my chicken sandwich is $1,000, and I get about 300 of it, and then the rest goes into compliance costs. But I make way more on the chicken sandwich, and yes, it takes me 2 months to get reimbursed for the cost of the chicken sandwich, but at least I get a ton of money for my chicken sandwich for all my time wasted in just providing it. If instead, again, I just sell you a chicken sandwich, and you pay what you can. You pay it or don't pay it, based on whether you can afford it, and whether or not you think that's a worthwhile chicken sandwich, or you want to get the McChicken for $1.99 or whatever. Then that's a choice that you can make, and it allows you to have different options. If we allow for there to be more options, and we allow for the price equilibrium to come into place, where people can't charge more than the market can bear and people can afford, that would reduce costs, that would increase access, and that would allow you to have better outcomes. It would allow you to not have to do all these other procedures and things that you may not even need.
So I guess I'm not so crazy is what you're telling me.
You're not crazy, and the reason that Amazon's giving you a hard time with your book right now is because the status quo is very scared right now, and that includes Amazon, that includes social media, that includes all of these. This includes the crony corporate media. Most media that we consume on TV and even radio media is owned by 6 multinational trillion-dollar companies who have a vested interest in keeping the Republican gravy train crony status quo going. And they know that if our ideas get out, when our ideas get out, because the only thing they can do is delay the amount of time that it takes for it to get out. When these ideas get out, their gravy train is over, and they'll have to pull themselves up by their bootstraps and live within their means, like they tell the rest of us to do every day.
Right. Well, and let me just clarify on my book, Amazon. I released my book last year, and I did no different this year. And just last week or yesterday, they informed me that my advertising didn't meet it was too political, basically. Yeah. I hadn't changed anything. But what's interesting is that we're getting close to election time, right? So now I will say this in Amazon's defense, I requested they review it, and they reviewed it today, and they approved the ad. So
good.
And I think that's a telltale example, Spike, of that we cannot let these big media conglomerates control our free speech. We need to call them out on it, whether it be Amazon, whether it be YouTube, whether it be Facebook. We need to call them out. And speaking of the 6 radios or 6 major media groups you're talking about, the only reason those groups get to be so big in the first place is because of government licensing. That's the only reason they're that big, and that's why they love the Republican-Democrat thing. They love the two-party system, because if they had to compete in a true free market, like the internet is still for now, largely, then they wouldn't have just 6 of those. There would be a lot, and they wouldn't be as big as they were. As those media groups are now. So
no, and we're seeing, Sean, in response to that, an increasing amount of regulations in the internet in order precisely to try to solidify a small handful of social media venues as the only real players in the game. That's the real problem. If when I hear that, Facebook is updating their standards and telling people what to do on their venue, I do think it's appropriate to push back and to say, hey, listen, we don't like this, and we don't want to use your venue, if your service, if you're not going to allow us to say certain things. I think that that's appropriate, but at the same time, it's not much different than me saying, hey, look, you can't hang out in my house or in my business if you say certain things that I don't agree with, and I don't want to have to hear that on my. So that's not the problem. The problem isn't that they're limiting what can and can't be said. The problem is they're limiting who can compete. Because if they weren't doing that and there were 20 other Facebooks, then when Facebook gets a little bit too strict, we would shrug our shoulders and go, all right, well, we're going over to this one instead.
Right.
Go say one over here, and that's good. That would be the market acting out. But when instead they are increasingly restricting things to make it like how the rest of the media is, that's where the problem comes in. I will say overall that Facebook, Twitter, YouTube, Google, and Amazon, etc., do tend to give the non-Republicrats out there a little bit fairer of a shake than just general major media, corporate media does. But they certainly have, they're certainly weighing in on trying to get their preferred outcome for the elections.
Yeah.
And that's understandable, but that's why they need to stop regulating and stop using the power of government to regulate others, so that we can basically go around them and make our own thing.
Right. Okay. So back to healthcare. You're talking about, the government ruined it. So I'm not just about complaining about problems. I'm about solutions. And on our podcast, and same with my book, I want to educate and empower consumers that they can be in control of their own healthcare. So what are you telling me is a solution to create a free market in healthcare? Are you telling me the government needs to completely get out?
So here are 3 things we can do. And yes, the short answer is the federal government has no business being involved in healthcare. I think the founders were wise to not even mention it in the Constitution,
Yep.
which according to the 10th Amendment means that it should be left
Yep.
to the states or preferably to the people. And not should be, is legally required to be. That's a whole other subject. I think that here are 3 things that can be done right off the bat. Number 1, get rid of those absurd regulations, regulatory burdens, and taxes and mandates that are driving up at least 75% of the cost alone. They do no good. They do not help anyone. They do not serve the public safety or health or anything else. They just make it harder for medical professionals to do their job. Again, we knew even before COVID-19 that the federal government is making it harder for medical professionals to do their jobs. And in the best of conditions, that means higher costs and lower access to affordable care. And during a pandemic, it means hundreds of thousands of lives needlessly lost. So we get rid of those regulations. That reduces the cost of healthcare to maybe possibly even 25% of what we're paying now. Not only does that make healthcare more affordable, it makes Medicare and Medicaid more affordable. It makes Social Security more affordable by reducing the costs that are endemic in those programs. So it fixes a lot of problems right there, or at least greatly ameliorates a lot of problems right there, just with that one thing. The next thing we do is we end the absurd patent protections on medications that have been around for longer than most of us have been alive. We do some serious reform of patent protections. This idea that you can take a drug and make one little small molecular change to, or not even a molecular change, but just a change to the way in which it's delivered, going from a mist to a powder or something like that, and declaring and using regulations to require that this is now the way everyone has to give it, and that this is the only way that insurance can cover it, and then driving up the cost tens, thousands of times more what they could charge anywhere else. That has to end. The restrictions, and I guess this is sort of a secondary part of that, we need to let people go and buy medications wherever they want to. If the medication's legal and they have a prescription for it, there's absolutely no reason to tell Americans that they can't go and buy it in Canada, can't go and order it from another country and have it sent here. There's zero reason. There is no compelling reason other than to protect crony profits. That's it. So we end those regulations as well. They are an infringement on your freedom, and allowing that competition would greatly reduce costs there as well. And then the last thing we do is we get rid of these absurd certificate of need laws. The idea that in order for you to build or expand a hospital or medical center, that you have to go to a municipality with a petition and get signatures to beg and scrape for them to allow you to get a certificate of need to build or expand your medical center or hospital, when that municipality has no interest in even doing this anyway. They're required by federal law to do it in the first place, or they wouldn't even be doing it. It's a stupid law. It makes it harder. It adds weeks and months and sometimes years to the process of building or expanding the medical facilities that the market clearly needs, or they wouldn't be building it in the first damn place. Because let's be clear, no one's building a hospital because they want to lose money. If they're building a hospital, it's because they know that there's a demonstrated need for it. Those are just 3 things that we can do, or I guess 4 things if you include if you do the patent and the pharmaceutical thing as 2 separate things. Those are 4 things that we can do that would greatly reduce costs as much as 80 or even 90%. And also increase access to affordable care and open up the markets, that not only do you have lower costs, but you have more opportunities and more options from which to choose.
So let's remember that certificate of need laws is not really about the new hospital or the new MRI coming into a facility or coming into a city. It's more about preventing them from coming in. So the current hospital or the current MRI has a monopoly, and that's got to stop.
It's about reducing competition.
Yes,
and that is for crony profits. But for you, the consumer of healthcare services, it's a reduction. It is a artificial reduction of supply and an increase in scarcity. And any economics professor will tell you, any person who's ever even studied economics will tell you, that when the demand for something is going up and supply is being restricted unnecessarily, that causes massive increases, because if supply stays here and demand goes here, then the costs go up. The value of that thing goes up, which means the costs go up. And if the costs are going up because of an unnecessary regulation that is causing that supply to remain static and not to go up to meet the demand, that means you are paying more unnecessarily because of bad government regulations that were set up entirely to protect the profits of the cronies who bought and paid for those politicians to go into office and introduce those regulations in the first place. It is a system of patronage. It is a kleptocracy where people get into office and steal from you your money, your freedom, your power, your ability to choose. All of those things are taken from you, and costs go up for you, access goes down for you, your life is made worse because of powerful people who don't give a damn about you and use you for your vote so that they can get into office and make things harder for you so that they and the cronies who paid for them can benefit from it.
Yep. So what are your thoughts about, we talked about, after the Affordable Care Act, health insurance premiums really going sky high, even though they weren't supposed to. My wife and I, we lost our health insurance because of it. Well, we decided that we didn't want to pay $1,800 a month anymore. So we found something different. We found what's called a health sharing ministry. And there's a lot of health sharing programs out there now, some of them that are non-faith based. Can you speak to those? Because there's some states and federal laws that are trying to stop those. So can you speak to those? I don't know if you educate on those or not.
I have a cursory understanding of them. Here's my understanding. They are a way around the healthcare requirements. The people that are using them, I've yet to meet anyone who's using them who hasn't said that they were happier with them than they were with health insurance. I know that in some states, the regulations make it harder where they actually aren't as good. But in most states that allow them, the regulations are low enough where the people who use them are at least as happy as they were with health insurance, if not more so. And I know that the federal government and the states are increasingly looking at edging them out, which typically means they're a good idea. So typically when the federal government says, hey, this thing is bad, we should stop this, it almost always, not always, but it almost always means that people are enjoying something and the government doesn't have enough control of it. So that's my understanding of health sharing. There are also, of course, the membership programs where people can pay a monthly fee to, get as much doctor's care as they need within a certain healthcare system. I think that that's a really cool model. Unfortunately, all of these models are designed to get around the existing regulations, which means they're not perfect. A perfect or as close to perfect as we could have plan would be one that didn't have any regulations to have to get around in the first place. Didn't have any, all these burdens and hurdles to have to jump over and get around in the first place. So the best thing that we can do at the regulatory and legislative level when we get into office is to remove those obstacles, those unnecessary burdens, so that the solutions that come forward have less and less to do with getting around loopholes and obstacles and burdens and barriers, and more to do with just providing you with the care that you want and need as affordably as possible.
Well, and I will tell you, in my book, I talk about health sharing ministries being one of the fixes. And there are a few of them out there now that are non-ministry based, so they're non-faith based. New Health is one of them. But anyway, because here's one of the things, it does get around the Affordable Care Act. And until, the Affordable Care Act is repealed, that's what we need to do. And here's one of the things that I think about traditional health insurance, not Medicare and Medicaid. We understand those are federal government insurances, and there's a lot of other federal government insurances, whether it be VA or what have you. But the Premier Blue Cross or United Healthcare, whatever. As far as I'm concerned, they are not private insurances anymore. People say, "Well, I have good private insurance."
No,
you know what?
Not private insurance.
It's not private because the government is so heavily regulated that they tell them what to pay for at what cost. So you want to speak to that at all?
Yeah, no, they are a government. That's why when I say Medicare, Medicaid, and government mandated insurance, I want to make it clear that this is no longer, if there was ever, because in the past, let's be, first of all, as I said before, starting off, health insurance, comprehensive health insurance was never anything the market wanted. This was just a way to get around, in the same way, similarly, that now health sharing and other things that are coming up are ways to get around existing regulatory burdens or proposed regulatory burdens. That's it. No one was saying, hey, let's find a way to add unnecessary bureaucracy to healthcare and make it way more expensive and tougher to get and make there be a line for healthcare. Let's do that. No one was saying that. They did that to get around a regulation. But you could choose who you wanted for your health insurance. You could choose whether or not you wanted health insurance. So there was at least some aspect of market principles to it. Now, that's not the case. Now you have to get it. Now in some states you get fined if you don't have it. So and for a while you were fined at the regular level you were taxed at the regular level. Any of us would call that a fine typically, but the Supreme Court decided it wasn't, so that they didn't have to rule the entire thing unconstitutional. But you get not fined for it if you don't have it. It is a government mandated thing, and then just as importantly, it is a heavily regulated thing. They decide, as we were talking about with pharmaceuticals, if the health insurance company wanted to say, okay, great, you found a new way to deliver insulin, but this other way was working fine and it's been around forever and it's a generic, we're going to just cover that. The federal government, who is owned by those cronies that introduced that new innovative way of providing insulin, says, no, you have to only cover this type of insulin. And they go, okay, fine, we'll cover it. We're not paying for it anyway. You are the taxpayer. And so they now are covering that. And that's why the costs go up. And so the side effect of that is when someone is poor and doesn't have coverage and can't afford it, they die, or they rely on GoFundMe's to pay for their insulin. And then other people will say, look at this. This is the free market providing healthcare. This is the problem, is that the free market has driven up the cost of insulin and made it where people have to go on GoFundMe to get insulin. We need government-run healthcare. That's what we need. We need at least single payer, where the government's paying for all the healthcare, or preferably where the government is managing healthcare entirely. I've met enough people who are using single payer healthcare in other countries, and I've met enough people who are using the VA and the National Health Service in the UK and the VA here to tell you that the more government is involved, the worse it will get.
Absolutely.
And that harm is going to disproportionately affect the poor and marginalized communities, because they have less money and less power than it affects everyone else. So not only will it harm all of us, it will, as most impositions in the market do, disproportionately harm those with the least amount of money and power to be able to try to find a way around it. They will be harmed by it. The answer is actual free market care. And actual free market care is getting those regulations out of the way, getting that cronyism out of the way, getting that bureaucracy out of the way, allowing price equilibriums to come back into the market, where they now are doing the same thing that stores do every single day, that they sell chicken sandwiches and salads and everything else that people want. And which, again, because people will say to me, and I know I'm ranting slightly, but people will say, well, free markets don't work in healthcare because you need healthcare. You need food. You need water. You could actually probably, the average person, and I say this as someone who has MS, the average person could go slightly longer with healthcare services, typically, not always, but typically, than they can with food. You can go about a day or two without food before things start to get really bad. And yet, we largely are able to just go and buy food if we want it. And for those who don't have food, they can largely be taken care of either through charity or a minimal social safety net to make sure that they have the food that they need. If we had a similar arrangement with healthcare costs would be a fraction. And when I say a fraction, I mean pennies on the dollar. What it would cost now, we would have more options, and we'd have more innovative solutions, because people who try to come up with new ways of providing care, they're stifled by all these regulations. They're stifled by the FDA saying, no, you got to spend about $1 billion before you want to bring that thing to market. All of that reduces the number of options you have. It makes the care that you get more unaffordable, and it drives costs up unnecessarily. We get rid of those burdens, introduce actual free market care, then things get considerably better.
Absolutely. So typically, what I've found is that, a government-based system like a hospital, they will bill their price will be about 10 times what a free market solution is. Let me give you a good example. So a local hospital charges $40,000 for XYZ procedure. Or a patient can go to the Surgery Center of Oklahoma. I don't know if you've heard of them, Spike, but Surgery Center of Oklahoma was founded by Dr. Keith Smith. He's a libertarian, and he founded it in 1997.
That's the membership program, right?
Well, he's not. He's fee for service, but he does promote a lot of the membership.
Okay.
It's a surgery center, and he takes cash only, basically. He doesn't take any government programs. And his price for that it's a great story. It's in my book. His price for that same procedure that was being offered in Georgia at a hospital for $40,000, his price, $4,000. So you're right, pennies on the dollar. If you make
cents on the dollar.
Yes, and we see that all the time. Usually it's about tenfold. My son recently had surgery at our local hospital. The care was great, but the expense was exorbitant. And it was about $46,000. That same procedure at Surgery Center of Oklahoma, $8,000.
Yep.
So, and one of the things is
and to be clear, because a lot of times when I will give these as example, people will say, yeah, but because they don't have to comply with the government stuff, the quality is not as good. That's not true. They actually tend to, if you look at the actual reviews from the people who have used those services, they're much higher. The reason for the reduction of costs isn't because they're cutting corners or doing things worse. It's just the opposite. It's because there wasn't 1,000 people between you and that doctor providing the care that have to get paid. That's where the costs are. When you are sitting in front of your doctor and they're saying, well, you've got to do this and this and this, you don't see it in that moment, but in between you are thousands of people whose salaries have to be paid because they are taking their part in the bureaucracy. You remove that bureaucracy and have it where the only person getting paid there is the doctor and whoever's the nurses that are helping them, and they're paying for whatever products and materials they need or whatever to do the services. Now, instead of there being thousands of people or hundreds of people between you and the doctor, now it's just you and the doctor and the handful of staff that work for them. That is where the cost is. It's the hidden cost of bureaucracy.
Right.
And it was done with the intention of creating a bureaucracy, enriching cronies, giving you worse options, making you anxious, so you let them take total control of the whole thing.
Yep. And actually, you're right. The service would be better. And here's my argument when you have a third party involved, any kind of insurance, government insurance, let's just call it what it is. Anytime you have a third party involved, that third party's paying the bill. Do you think that entity, that healthcare entity, cares about the patient as much as they care about the third party paying the bill? Let's think about that. The third party is the customer. They're the ones paying the bill. So they're the ones that are going to get the good service, not necessarily the patient. That's why when patients pay cash, and you look at the membership models like you talk about, direct primary care, or like the Surgery Center of Oklahoma, or cash surgery centers, that's why they take care of the consumer so well and their service is good, because that consumer's paying them.
And if you got rid of the regulations so that now more people could be doing that, you'd see those costs go down even more, because
Absolutely.
Right now Surgery Center of Oklahoma doesn't have any competition.
Yeah,
and I'm not talking bad about Surgery Center of Oklahoma, but in any way at all.
Yeah.
But two things would happen. You would have a greater economy of scale because more people would be doing those types of services, which means that the providers who are providing to those would have to ramp up supply to them. That reduces costs on their end, and they have to reduce what they are charging because now there's competition. Now there's not just Surgery Center of Oklahoma. There's also Surgery Center of South Oklahoma, and
Right.
Surgery Center of East Oklahoma, and Surgery Center of 2 blocks away from Surgery Center of Oklahoma. And when that happens, costs naturally go down because they have to do what they can to cut the profit that they're getting in order to be able to get the business from the client. That reduces costs even more, and it increases innovation, because now with those regulatory burdens gone, if someone figures out an even more efficient way or a more effective way to do the surgery at a lower cost or better service or better service and lower cost, now everyone has to step up their game and do the same thing too. These are all the things that you lose with those regulatory burdens in place.
Yeah, that's true. And here's the great thing is Dr. Keith Smith from the Surgery Center of Oklahoma, he knows about free market principles, and he knows, and he likes competition. He really does. And he knows that it makes everybody better. So, I appreciate that comment. So here's the thing. Speaking of surgery centers, right now in our healthcare system, the same surgery at a hospital gets reimbursed way more than it does the same surgery at a surgery center from Medicare and Medicaid, these government programs. Now, that to me, now hospitals will say, well, it's a lot more complicated in a hospital system. Well, it's complicated because they make it complicated, right?
Exactly. It's complicated because the hospital system has been made unnecessarily complicated.
They basically admit they're inefficient when they say that they can't do it for the same price a surgery center is, or a surgery center does. Can you comment on that?
Yeah, no, we see more and more that people that are getting like outpatient surgeries are going to surgery centers. They're having organs removed. They go to a place. I was honestly horrified the first time I heard it. One of my neighbors had her, I believe it was appendix or gallbladder removed. It was one of those. She was home that day. I was horrified. I said, there's no way. There's no way. Meanwhile, she was happier. She went there. She ate breakfast, went to the place, had the surgery, skipped lunch, because as one would, and then had dinner at home.
Amazing.
Yes, she was sent home with some meds.
Yeah.
She was otherwise, healthy and everything else. She was thrilled. I'm like, are you okay? She's like, yeah, I'm fine. If something happens, I can go to the hospital, but I'm fine. I'm home. I'm where I'm comfortable. I am in pain and will be for the next. And she was in pain for a few days, and then she was fine. And it was done at fractions of the cost. Hospitals are not an efficient way to provide care. Hospitals are a way to provide immediate care to someone who is not in a position where they can go home. They have to be there all the time until they are discharged where they can get the care at home. Okay. I have MS, and there was a time I had to be in the hospital for a few days. I hated every second of it. I wanted to be home. I knew that in that moment, it was best that I be there because they didn't know what they were dealing with at the time and didn't know what kind of risk to my health there was. As soon as they realized that I could go home and they could, do this on an outpatient basis, they did it immediately. My stress level immediately dropped to a fraction of what it was previously because now I'm home.
Right.
I know that if I need the hospital, it's there, but I'm back home where I belong with my terribly outdated couch here. And I am, I am happy, and I can look at my equally outdated horse painting and have, enjoy my life. And, there is a level of inefficiency that comes from, requiring people to go to a building where it's not needed and where the most amount of bureaucracy is. You go into a doctor's office, there's 4 or 5 administrators. You go per doctor. You go into a hospital, there's 15 administrators. And the only reason there is because of the regulatory burdens. There is nothing there that is actually making you safe. You're actually having to interact with more people, which we're learning in the pandemic. The fewer people you are required to interact with when your immune system is down and you're sick, the better. And yet here you are having a bunch of people in your face making you sign papers and everything else. It is not contributing to your care. It is not contributing to your well-being. It is making you stressed out for no good reason, exposing you to potential pathogens. And the only reason they're doing it is because the law requires it.
Yep. Okay, so speaking of pandemic, I know we got to wrap this up. So what do you think about the government mandating masks and mandating lockdowns?
For the first 2 months, we have to get back to the root here. For the first 2 months that the virus was here, the CDC, the organization that the Republicans put in place to protect us from disease, banned medical professionals from testing and treating patients who had COVID-19. When patients were coming into their doctor's offices and saying, "Doc, I don't feel too hot. I just got back from Wuhan, China, or Hubei province, China, or whatever, and I'm not feeling good," or "I have a loved one who just got back from there and now I'm not feeling too hot, neither are they," the doctor had to go, "Well, we can test you for the flu and hopefully it's just that." That was for nearly 2 months while the CDC tried creating their own test kits, and while they told the free market people, while they told the providers and the companies that were making test kits that they had to go through this Byzantine months-long process to get approval. You had companies in the US that were making approved, effective COVID-19 test kits and selling them overseas because they couldn't legally sell them here to us and our providers. That went on for 6 to 8 weeks, almost 2 months. This virus could have potentially been contained, or at the very least, the spread could have been slowed greatly. And instead, because of those ridiculous, stupid regulations that everyone acknowledged were stupid, and that they eventually got rid of because of civil disobedience from doctors who illegally tested patients and released it to the public so that they could see how stupid this whole thing was. Because of that, we don't know how many tens or hundreds of thousands of lives will end up being lost as a direct result of the federal government being involved in healthcare. So when we are told the government needs to be more involved in healthcare, the government's plenty involved in healthcare. Enough people have died, but thanks. This is a perfect example of why we need government out of healthcare. Now, when it comes to the masks and the lockdowns have happened because of a pandemic that was largely imposed upon us by bad regulations. So all of the suffering we are seeing from the virus is happening as a direct result from that. Now, what have they done? They told us to shut down everything until further notice. We ourselves could lose everything. We get $1,200. We're told to make that last until further notice. And that if we don't comply with what they tell us to do, that they'll put us in a cage where we're almost certain to contract COVID-19 for our safety. At the same time, the big businesses are getting trillions of dollars in bailouts whenever they need them to make sure that their bottom line isn't even remotely affected during this entire thing. That is why we are in the middle of the worst economic depression in the modern era, while simultaneously stock prices are at all-time highs. Because they are robbing trillions of dollars from you that you and your children and their children and their children will have to pay off for the next 40 years with interest. Every single aspect of what they are doing is a perfect example of what happens when Republicrats use their presumed authority to aggress upon you and take from you to enrich themselves and their cronies while you suffer. These lockdowns did not slow the spread. The spread was still going. Okay? What did it do? It caused massive human suffering. It caused people who had addictions to not be able to go to AA meetings because those things weren't essential. But the stores that sell alcohol were essential. It caused people who had small businesses that had spent years and decades building them up into something that they could live off of and that they could provide jobs in their communities and help grow their communities to lose everything in a matter of weeks. It caused people who need cancer screenings and other necessary medical procedures to have to wait months, to this day still be waiting to get those procedures done because those hospitals were mandated to only cover COVID patients, even though those hospitals said that they had the protocols in place to protect the non-COVID patients from the COVID patients, while simultaneously they put COVID patients in nursing homes.
Yep.
While those nursing homes said, we do not have the protocols in place to protect the most vulnerable population in our country, seniors who are sick in nursing homes from those COVID patients, the states went, no, that's what it says here on the magic sheet of paper we have to do. So here you go, off with you. We have seen in every single case how massive human suffering that is far worse than the actual virus itself, not to mention the incalculable economic damage that's happening. I'm just talking about the immediate human suffering, healthcare suffering that is happening as a result of this at every single and it's only happening because the federal government didn't allow medical professionals to do their job and test and contain the virus when that was possible. At every single step, the federal government has demonstrated why they should be the hell out of our healthcare, the hell out of our lives, and allow us and the professionals in the given field, in this case healthcare, to do their jobs to ameliorate the problems instead of making them worse by imposing burdens and obstacles on us and trying to do what we need to do.
I love it. Boy, I love your passion, Spike. You don't have to apologize for ranting. I do it commonly. and I love it when somebody has a passion and knows their subject matter. And the great thing is about, when you speak of libertarian principles and just liberty in general, you don't have to, you just tell the truth. So
you don't have
it's
to
pretty.
spin it. Yeah.
No,
yeah.
You don't have to spin it. You just tell the truth because it's all about liberty, and it's not just it's not just about my liberty. It's about other people's liberty. Think about how it's going to affect not just me but anybody else.
Everyone else, exactly.
Everyone else. So if you just think about that and just think about liberty, it just makes sense, and it's easy to tell the truth. So with
Exactly.
those and stick to those principles. You don't have to spin it at all, just like you said. So, Spike, I appreciate your time. This has been a wonderful, wonderful show and podcast, and you've really helped to meet our goal of educating and empowering consumers that there is an answer to healthcare, and the answer is not more government intervention. Just like my book Sickened says, not more government intervention. It's less government intervention. It's free market principles. The patients, the consumers drive it, and price will go down, service will go up. I appreciate your time.
Put the power and the money and the freedom back in the hands of the people where it always belonged, and they will come up with better solutions for themselves, working with each other in cooperation, than a bunch of cronies thousands of miles away could ever do, even if they wanted to.
Amen, brother. I like it. So thank you, Spike, and I appreciate your time. You've been listening to Health Solutions with Sean and Janet Needham. Tune in Monday. We will be streaming live again on Facebook and the Mosaic Professional Pharmacies YouTube at 1 to 2 p.m. Thanks for listening and watching today.